Lancaster General Health has been named as one of America's 50 best hospitals by Healthgrades, which is an online resource that provides information about healthcare systems. But recent inspection reports from the State Department of Health faulting LGH for multiple violations paints a bit of a different picture. Fox 43's Alyssa Kratz spoke to an independent agency about how people can take all of this information and use it to make an informed healthcare decision.
Yeah, Evan, I talked to the Pennsylvania Care Cost Containment Council, which is an independent state agency which collects data about our state's hospitals and presents objective facts. They say Penn Medicine's Lancaster General is a great example of the difference between this kind of aggregate data and individual tragedies. Lancaster General Health has been named one of America's 50 best hospitals by Healthgrades. But LGH was also recently faulted by the State Department of Health for several infractions, which included operating on a patient's wrong leg, employee violations of hand hygiene rules, and failing to file reports related to a new mother who died of internal bleeding.
Even within our reports across a number of different conditions, Lancaster General has great outcomes, right? Lower than expected mortality, lower than expected readmission across a number of different conditions. But that does not take away from the individual tragedies that have occurred pretty recently.
Heather Nairn is the Deputy Executive Director of the Pennsylvania Care Cost Containment Council, or PHC4. The agency provides objective, comparative information about the cost and quality of health care across the state.
So if you were trying to make that decision for a breast cancer surgery, for example, we have reports that give cancer surgery volumes. So you might look at the county where you live and surrounding counties and say, out of those hospitals that are available to me, which ones perform this surgery the most?
She says when people are making big healthcare decisions, it is important to pay attention to reviews given by other individual patients.
There is a great deal of value in that, right? That's the patients giving their patient experience, but it's only selective anecdotal portions of information.
And that's why she says there's equal value in researching independent data provided by groups like PHC4 or Healthgrades.
What was the mortality rate? What was the readmission rate within 30 days? Meaning, when someone was treated for a condition and released from the hospital, were they then able to self-sustain with outpatient services, or did something flare up and they needed to be readmitted back to the hospital?
And patients should set up consultations with doctors and other healthcare professionals to go over it all.
Set aside time to speak with their doctors about the information they're finding and ask for a consultation to help translate that and understand it.
And we did reach out to Lancaster General Health requesting an interview for this story, but we were told no one was available to speak with us. Alyssa Kratz, Fox 43 News.